Hello, my name is David Nelson, and it is a joy to be here. And today I'm joined by my friend and colleague, Yvonne Greer. I'm so glad that we can spend a little time talking about our project that we did together. Our project was a CDC-sponsored grant called the 1815 grant. And the 1815 grant supported chronic disease prevention, especially type 2 diabetes and hypertension. We just completed a 6-part series called Back to the Kitchen with Yvonne Greer, registered dietitian and nutritional consultant for healthy eating. It was a lot of fun doing those show series with you, Yvonne, and we had to make some pivots due to the pandemic. Can you tell us a little bit about what we accomplished?
Yes. Originally we had did the Days of Learning as a conference that we would do, and we would have different breakout sessions, and I would do some type of interactive educational or food demo so that people can develop skill building. So as the pandemic came along and we wanted to look at how are we going to be promoting diabetes and chronic disease prevention efforts, we looked at developing a podcast series, which you were gracious to be the moderator. And then we decided to do a 2-part kind of program that included a video segment of me in my kitchen, really doing some recipes that are in the curriculum that we had developed called the Back to the Kitchen Healthy Cooking Curriculum. And then also as part of that presentation, we were going to then have some of the community champions come on board. So first idea was to use a different platform to do skill building where people can actually see delicious and nutritious recipes being made, look at the ease of cooking from scratch, and then also be able to showcase healthy cooking techniques and also simple utensils that people would need. We did find out from previous work that there was a lack of skills in cooking that needed to be rediscovered. So that was prime for this type of a video segment to be done, but it had to be transitioned to my kitchen versus a live program. I wanted to mention that the episodes were based on the My Plate. So each segment would take one segment of the My Plate. So back to the kitchen with fruits, with vegetables, with meat and dairy and that type of thing. So those segments was able to provide a platform for the grassroots individual to come on and to share their voice, their motivation and experiences in working with the community to promote health and wellness.
I think it's important that we talk about the cultural exchanges that were going on. You told me an example. Can you share that with our audience, please?
Yes, the example was in our first program, we highlighted G's from G's Clipper, and he has a health center that has been developed in the barbershop. And it's very important that understand that African-American men have different trauma and different trust issues with the medical profession. But having that clinic right in the barbershop helped to break down those different barriers, and people, men are now talking to their barbers, getting health screenings right there in an area that they are very comfortable in.
You know, we always say meet people where they are. Yvonne, could you talk a little bit about some of the other foundational issue that you thought was really important in this series?
I think that, you know, creating safe spaces for people to be able to share their knowledge, skills, and to learn from each other, both from the clinical side and from the community side, is just so important to happen.
Yvonne, from this 6-part series, can you tell us what mattered most to you?
What mattered most was the idea that deeper relationships and connections were made with the community and within the community champions. Some didn't even know the other ones that was on the program. And so we have developed a richer and connections between all. What mattered most for you in doing this series?
Thanks for asking, Yvonne. I think for me, and I've really appreciated our relationship over the years, that we have to make sure that we always have the perspective of the community we're trying to reach. We especially want to highlight the assets that exist. Too often those assets go unnoticed, and so we need to do what we can to spread the word for these. Thank you, Yvonne, and thank you for joining us today at this brief presentation.